Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with infections, infestations, and the immune system, starting with the letter B. But before I do this, I wanted to let you know that because of a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system. Then I'll address issues with the skin, nails, hair, ears, eyes, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism and infections, infestations, and the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, special problems of infants, childhood diseases, special issues of adolescents, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories, called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum Album types, those who react strongly to Arsenicum Album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature beer people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with infections, infestations, and the immune system, starting with the letter B. Infections are an almost daily occurrence, but if we are healthy, our immune systems deals with them before we notice any symptoms. Most microorganisms enter the body through the nose and mouth, in the air, in our food, sometimes on dirty fingers. Some enter through cuts and abrasions, while others invade the urinary or reproductive tract through the urethra or vagina. Many of the microorganisms with which we share this planet are harmless. Some permanently inhabit the inside and outside of the body. A few even produce substances useful to it and prevent harmful bacteria from finding a foothold. This is true of certain bacteria in the large intestine and vagina. Some bacteria are harmless in one part of the body, but damaging in others. This is true of E. coli, which is benign when it is in the colon or rectum, but harmful if it is transferred to the urethra, vagina, or mouth. Each kind of microorganism, whether it is a bacterium, virus, fungus, or blood parasite, carries special chemical markers known as antigens. Some strains of lymphocytes which is a kind of white blood cell produced in the lymph nodes, spleen, bone marrow, adenoids, tonsils, and the wall of the gut, recognize antigens and stimulate other lymphocytes to produce proteins called antibodies, which then disable the carrier organism. Other lymphocytes directly attack and destroy the invading organism. For about 6 months after birth, babies are protected by their mother's antibodies, and after that, the immune system is sufficiently mature to start manufacturing its own. Homeopathic immunization does not involve introducing live or dead viruses or antibodies into the body. Instead, remedies are prepared from diseased tissues or secretions using the traditional dilution and succession method. Like other homeopathic remedies, they contain in highly potent form the essence of the source material used, in this case, the essence of the disease organism and its toxins. The body reacts to such remedies, known as nosodes, by sharpening its immune response. The production of antibodies in response to antigens, the so-called immune response, is not the body's only line of defense. The body's first line troubleshooters are neutrophils and macrophages, which are two kinds of white blood cells that constantly patrol the bloodstream and tissue fluids and respond immediately to the chemical and thermal signals sent out by tissues when they become inflamed. If inflammation is suppressed, white cell activity is impaired. Neutrophils and macrophages gobble up and digest offending microbes, foreign particles, and other noxious elements. The resulting pus is a mixture of necrotic tissue, dead bacteria, and dying white blood cells. Infection can be treated by killing the germs that cause them or by helping the immune system to deal with them, or both, depending on general health and the virulence of the infection. Traditional antibiotics can deal with bacteria, but not viruses. After a course of antibiotics, live yogurt or kefir, eaten daily for at least 5 days, helps to repopulate the gut with the beneficial bacteria that the antibiotics have killed, along with the harmful bacteria that was their main target. Homeopathic remedies, improved nutrition, fresh air, exercise, and rest can restore the coping ability of the immune system. In some cases, homeopathic remedies and antibiotics are used together, may be necessary. Constitutional homeopathic treatment is always advisable after serious infections. Occasionally, as a result of aging or exposure to certain viruses, bacteria, chemicals, and environmental factors, the body loses some of its ability to discriminate between self and non-self, or fails to recognize and destroy its own abnormal cells. The first kind of impairment leads to autoimmune diseases such as rheumatoid arthritis and systemic lupus. The second leads to cancer. Allergies, distressing reactions to certain drugs, chemicals, foods, and other substances that seem to be tolerated by the majority of people, are the downside of having an immune system. Bacterial infections that are affecting the gastrointestinal tract. The various diseases that may arise in the gastrointestinal tract because of bacterial infection are cholera, dysentery, food poisoning, and peptic ulcer. For cholera infection, a cholera infection usually occurs by drinking or eating foods and drinks that are contaminated with the cholera bacteria. In an epidemic, the source of the contamination is usually the feces of an infected person. Cholera spreads rapidly in areas where there is an inadequate treatment of sewage and drinking water. Cholera is the illness caused by the bacterium called Vibrio cholerae. It infects the intestines, causing diarrhea, vomiting, great thirst, and leg cramps. The mode of action by which the bacteria produces these symptoms is by releasing a toxin, which starts absorbing water and electrolytes from the body through the intestines, producing severe diarrhea. Cholera can be mild and not even cause any symptoms in some cases. However, a severe infection can cause death if not treated immediately. Diarrhea and vomiting that the infection causes can quickly lead to dehydration, and this can make a body go into shock, causing death within a few hours. Signs and symptoms of cholera. Medically speaking, the cholera bacterium has an incubation period of 1 to 3 days, which means that the symptoms can take from 1 to 3 days to show up from the time the infection entered the body. Cholera can be a mild, uncomplicated episode of diarrhea or a potentially lethal disease. In the classic case of cholera, sudden painless diarrhea and vomiting are the initial symptoms. Uncomplicated cases of cholera are self-limiting, and the patient recovers within 3 to 6 days. The fatalities are more than 50% in untreated cases and less than 1% in cases that are treated in time. The main aim of the treatment is to replace the lost fluids and electrolytes in the body, initially in mild to moderate cases, or oral rehydration is advised, using a solution of 1 teaspoon salt to 1 teaspoon of sugar in 2 pints of boiled, then cooled water. In advanced cases, when the patient is not in a condition to take oral hydration, intravenous rehydration is recommended. Specific remedies to be taken 4 times daily. Number 1, Veratrum Album. For copious vomiting and diarrhea with marked nausea, which is profuse, yellowish, watery, and forcible, vomiting soon after taking fluids with a stool watery, greenish, gushing, and is often mixed with flakes. There is a cold feeling in the stomach, excessive weakness, cold sweat, pale face and sunken eyes, and dark shadows. Quick feeble pulse and cramps in the hands, calf and feet and muscles. Use Veratrum Album 200C. For vomiting of clear water with nausea, retching, and diarrhea, the stool is rice watery, foul, and may be involuntary in some cases with anxiety and restlessness. Use Arsenicum Album 30C. For when the patient loses strength rapidly and there is sudden diarrhea with watery and sour-smelling stools, the stools may be involuntary with colicky pain in the abdomen. There is water and slimy vomit, and coldness of the body may be present. Use Camphor 30C. For profuse diarrhea that gushes out, the urge to pass stools is constant and urgent. The stool is watery, yellowish, or dirty greenish, and profuse. There is a lot of rumbling and gurgling in the abdomen with flatulence. Extreme weakness, nausea, cold body, and dizziness may also be present. Use Croton, tiglium 30C. For painless diarrhea, the stool is yellowish green, watery, gushing, offensive, but does not cause any abdominal pain. Foul-smelling flatulence and gurgling on the bowels, followed by copious evacuation of the bowels. Vomit is hot and frothy. Use Podophyllium 30C. Urgent and sudden need to pass stool, which is constant with fullness and weight in the rectum. The stool is watery, profuse, yellow, and hot with pinching colic in the abdomen. Rumbling and gurgling in the rectum is also present. Use Aloe 30C. For prominent muscle cramps, particularly in the toes, fingers, and calf muscles of the legs, the diarrhea is greenish or grayish water with violent cramps in the abdomen. Pressure is felt in the pit of the stomach and worsens with touch. Vomiting of watery, frothy, greenish fluid is present. Use Cuprum Met 30C. When nausea is marked, distressing, and almost constant vomiting of greenish, yellowish, or gelatinous material may be present. Diarrhea with stools loose, greenish, yellowish, greenish, putrid smelling with flatulence. White mucus may pass in the stool, and a gripping pain around the navel is most marked. Use Ipecac 30C. Vomiting of bile, yellowish, greenish mucus with violent gagging. Loose, copious, watery stools with mucus and colors like greenish, bright yellow to orange, yellow color. Foul flatulence. White membranous, shreddy particles may pass on the stool. There is a need to pass stool, but it is ineffectual. The stomach is sensitive to touch, and intense nausea is frequently present. Use Colchicum 30C. Also, there is a Cholera Nosode 30C and 200C potency. Self-help. Steps to prevent cholera. Follow this rule of thumb for eating anything. Boil it, cook it, peel it, or forget it. Drink only water that you have boiled or treated with chlorine or iodine. Other safe beverages include tea and coffee made with boiled water and carbonated bottled beverages without ice. Eat only few foods that have been thoroughly cooked and are still hot, or fruit that you have peeled yourself. Avoid undercooked or raw fish. Make sure that all vegetables are cooked. Avoid salads. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.